Medication often plays a large role in managing your pain, although is most effective when used alongside other strategies such as pacing and mindfulness. I'm sure most of you will have tried lots of different medicines over the years with varying degrees of success. Quite often they may have helped for a while, or the side effects have meant that it was impossible to continue using them. I'm going to discuss some important do's and don'ts regarding your medication management, and then look at how to rationalise your medications if that is something you're keen to do. It sounds obvious, but how many of us would admit to not quite taking our medicines as prescribed? Perhaps you found yourself taking them earlier or later than you ought to. Perhaps you've been taking more or less than was recommended. Although this is very common when people are taking medicines for a long time, it can make your medicines less effective and can even be dangerous. This might be something worth reviewing yourself. Some people forget to take their medicines or take them at different times of the day or night. To get the most out of your medicine, it helps to get into a routine of when you take your medicines. This helps to remind you when to take them and gives a good guide to what may be helping more, what gives you side effects, for example. It's always a good idea to have the support and expertise of your GP or nurse. They have experience and the advantage of talking with lots of people who have pain, and so have learnt many tips from them. It's really important when you're feeling okay to continue taking your pain medicines. If you stop suddenly, this could cause a flare-up in your pain later on. It is also harder for your body to get used to the side effects of your medication if you aren't taking them regularly. If you do want to reduce the amount of medicine you take, or to even stop taking one of them, you will find it easiest to do this with some help from your GP or practice nurse. Generally speaking, it's always best to reduce medicines slowly before stopping taking them. We'll talk about reducing medications effectively in a moment. Many people don't like taking medicines, and some people even think that they are giving in or being weak in having to take painkillers. However, there's no point in struggling with the pain if you have something that may help to reduce it. There are no prizes for seeing how long you can tolerate it. Also, waiting until the pain is unbearable may make it harder for the medication to control it. I want to talk about side effects in relation to your pain medication for a moment. The side effects that can occur with a lot of pain medicines that you may have tried can often play a large part in whether you persevere with them. It may be that the medication has reduced your pain, sometimes even significantly, but the side effects from those drugs can be so debilitating and difficult to cope with that you have to stop taking it. Many of the side effects do reduce with time, and if you can manage to give the medicines a good opportunity before you stop taking them, then this will only help you. So, moving on to thinking about reducing or rationalising your medicines. Some reasons for considering this are that you feel they're no longer effective, the side effects now outweigh the benefits achieved, maybe you don't like taking so many tablets every day, or you don't need to take them anymore. There may be a time when you might want to consider this. It's not something that has to be done, and there is no timescale to set. It's just something that you may begin to think about and have perhaps thought about in the past. Hopefully you can see that this has to be done with thought and preparation. So, what are the advantages and disadvantages of rationalising your pain medicines? Reducing your medicines can help you feel more in control, which affects many other things. You will have fewer side effects to put up with and will perhaps feel less drowsy depending on what you're taking. Reducing your painkillers can also sometimes allow you to use them more effectively when you're having a flare-up. This applies particularly to the anti-inflammatories and morphine-based drugs. All of these things are pretty obvious and self-explanatory, but it is still a very daunting thought for most, as the biggest worry is that the pain gets worse and you end up back at square one. That is why it's really important to do this systematically, following some key rules. You really have to think about when would be the right time to do this. If there are other things going on, any problems, added worries, going on holiday for example, this can affect how you may manage. It speaks for itself that during or directly after a flare-up is not a good time to consider reducing medications. Start at a quiet time of the week, no school runs, everyone out of the house for example. This gives you a couple of days peace when perhaps there may be an increase in pain or side effects. Use other coping strategies that you may have developed, such as mindfulness, relaxation, or any other coping strategies. It's very important for you to get the support of your GP or nurse to help you work out your plan. They must be aware of what you're trying to achieve. It can be difficult to get a clear picture if you're on lots of medicines for a long time, and your pain can have natural fluctuations. Keep a pain diary over a long period if required, as this can help to spot the natural variations in your pain levels. You can sometimes be surprised when you keep a diary how your pain changes when you change medicines, doses or dose times. It's really important to have this clear in your head before you start changing any medicines. Starting with a drug that could be difficult to reduce or must be reduced very slowly can be a bit disheartening for anyone. It's a good idea to get the advice of your doctor or nurse and choose the medicine that is going to be the easiest to stop first. Before you start, it's important to be taking your tablets regularly by the clock, as this helps you get into a routine and set a pattern. Only ever reduce one drug at a time. Yes, this takes longer and perhaps can be frustrating, but remember what the long-term goal is, and this will be reached more easily by doing things very slowly. Doing this also when you're taking lots of different medicines can also help you work out which medicines are working best for you. Never, if you're sore, try to increase the time between doses. This will just increase your pain and is not a good way of reducing medicines. The best way is to continue to take them regularly, but very gradually reduce the dose. Again, medical staff can offer advice and support with this. Ultimately, making any changes to your medication is all about weighing up the risks against the benefits. To make these difficult decisions, you need to have adequate information and advice from an experienced health worker. Thank you.